That and more here on Answers on Aging, plus many special guests and announcements on senior activity. Now, your hosts of Answers on Aging, Todd and Sara.
All right. Good morning, Northwest Arkansas, Northeast Oklahoma, and South Missouri, and some of Kansas. This is the Answers on Aging radio show, and I am very, very, very happy that you're out there listening to us. And we have a great show today because everybody has questions about Medicare and Social Security almost every show calls in. So a little later, we're going to have the expert on to discuss that in a previous post of this show quite a few years ago. So thankfully, I am not here alone. I am here, as always, pretty much always, with my beautiful co-host. Sorry.
I didn't hear my doctor. How are you today?
I am doing fine.
Good. Fine as frog hair? Frog hair. How are you, Tommy?
Doing all right. I'm fine as frog hair, man.
Pretty fine.
That is.
Pretty fine.
Yeah.
Welcome, everybody, to our weekly radio program. Extravaganza. Answers on a. Hey, Trisha just texted and said it's hard to troubleshoot. Yes, welcome, everybody. This is nice that you. And helping seniors live their absolute best lives possible. And so we cover a wide variety of different topics each week. And a lot of the topics that we choose to cover have very much to do with what goes on in Todd's office the week or weeks leading up to Radio Day. And so Todd is a certified elder law attorney. He has an office in Bentonville, and like the senior. When I say senior, I mean like the longest practicing certified elder law attorney in Arkansas. And my background is in nursing home, social work, and administration. And now I work with Todd in the office with the clients initially coming in to find out what kind of documents they need or what kind of estate plan that we can help create for them. And it's super fun. I get to meet a lot of you out there who are tuned in because you tell me when I ask, how'd you hear about us? Sometimes I don't even have to ask. Like, that's the first thing that you say, and we absolutely love knowing that what we're doing every week makes a big difference, and also that we're able to help y'all along the way. So thank you so much. And before I even give out the numbers, we have a call. Let's take it.
Hey, caller, thanks for calling. What can we do for you?
Yeah, I wanted to ask Todd a question.
I'm here.
Okay, I live in Missouri.
Okay.
Okay, does that beneficiary deed, will that work in Missouri too, the way you're talking it does in Arkansas?
I don't know because I am not licensed there, but that's a great question. We do have quite a few Missouri listeners, and I need to figure that out. So give me, Sarah, please make a note on your phone or something to have me research that. I know some Missouri lawyers, and I will call them, and I will get the answer to that, and I will have it next week, okay?
Okay, I appreciate that.
You're welcome. Thanks for calling.
Thank you.
You're welcome. Yeah, beneficiary deeds are huge. I bet I did 3 or 4 on Monday.
Mm-hmm.
I mean, it's just the thing to do nowadays. And now there are times that you need a trust, but it's rare, honestly. And so we're doing a ton of beneficiary deeds because it avoids probate and it protects
the property from the Medicaid lien, which is the two things people really want to do. And as long as you're willing to hang on to it until your death, that is the deed to do, and it just solves a whole lot of problems. And so I will find out if we can do that in Missouri.
Yeah.
I will call my good friend. She is a certified elder law attorney in Kansas City, Missouri, and Kansas City, Kansas, and so she can answer that question for me.
Perfect.
Yeah.
Well, thank you for that call right straight out the gate before we even begged you to call.
That's right.
Man, that's awesome. But if you are just listening to the show for the first time, welcome. If you are a loyal listener, thank you. I did meet with a married couple, I think it was Monday, and she works at a local bank in the trust department, and she said Kerm on in the background all the time, especially for our show.
Yay.
And they came in and they said, I was like, well, how can we help you? And she said, we need a beneficiary deed. Or we're pretty sure we do,
and it's funny because she's a trust administrator, right? Or she works in the trust department.
Yeah. And so here's the thing, though. She takes notes of different topics that we cover that will help her clients. And so when we were going through the motions, I was gathering information about, everything we needed for a beneficiary deed. I didn't even think, for whatever reason, until we got down to signing the contract to tell her how much it cost. And she said, "Oh, we knew. It was in her notes." Like she wrote down, it avoids probate, it's protected from the Medicaid lien, and you get to control and own and live in the house. I mean, she had all the bullet points.
Very good.
I was very proud. I was like, dang, you take some good notes. So if you're listening, you know who you are. Thank you so much. And we look forward to getting your beneficiary deed to you on Monday.
All right.
Yeah. So if you are in Northwest Arkansas and have questions about anything that we cover today or something that we've covered in previous shows, please give us a call, 636-7979. Anyone outside of Northwest Arkansas can dial 1-800-767-7979, and I'll do Facebook shout-outs after we take this second call. Hey, good morning. Thanks so much for calling. How can we help you today?
I was reading an article a couple of days ago that said that a veteran with his DD-214 could go to Social Security and get an extra $100 a month for serving between 57 and 2002. Have you heard anything, or could you check on that, please?
I am a VA accredited attorney, and I have not heard of that. What were you reading? Was it?
Well, it was on Facebook.
Oh, well, it's got to be true since they have fact checkers and they make sure that everything's absolutely the truth. So I have not heard of that. There is a VA benefit out there that if you are spending a substantial portion of your income on care to stay at home or assisted living or even nursing home, and if you serve during a time of war, there's substantial money. Like for a veteran, it's about $1,800 a month. If you're married, it's about $2,100, and if you're the widow of a veteran, it's about $1,200. And so there is some money out there, but I don't know that just because you served then and they would give you $100. I've never heard of that.
Well, it said the article said you need to take your 214 and go to Social Security to
call them. Yeah, just call. I would not go down there because I don't want you to waste your time. But yeah, just call the local Social Security office. Expect to be on hold for an hour or so. But yeah, give them a call and ask them that. And if it's true, please call me back because I want to know that, because I do my best to stay on top of VA benefit issues, and I don't know of that. So yeah, please let me know. Okay.
Thank you very much.
You're welcome. Thank you.
Great question.
All right.
Thank you so much.
Let's get Will on the phone, and
Yeah.
we'll start that.
Okay.
All right, I'll give him a call. Y'all go ahead and I'll tell you when
yeah.
we got him here.
While we're waiting to get the Medicare expert, Will Corporon, on the line, I wanted to let all the listeners know that we also have a live stream on Facebook. It's a video of today's show. I mean, why wouldn't you want to just watch us talk?
Sarah looks
Sit here and
all
talk.
dressed up. She's got a pink top on. I'm wearing a hat and a gray long sleeve T-shirt.
I'm
so
not really
I'm not
dressed
much to
up.
look at.
I've got yoga pants on and tennis shoes, but thank you. But anyway, so if you have Facebook, type in the search bar, Answers on Aging, and you can pull up a live feed of today's show. There is also a really cool thing out there called a podcast, and we also have a podcast. It's basically a spin-off of this show, more condensed version, a little less casual, you know.
Straight to the topic.
Straight to the point, get the facts, get the info. You can go to our website if you don't have a smart device with a podcast platform. It's called AnswersOnAgingPodcast.com, and really want to encourage the listeners to, if you haven't already ventured out into the podcast listening world, just take the plunge. Just do it, check it out, and let our podcast be the first thing that reels you in, because you're going to get hooked. It's pretty fun. I'm a podcast enthusiast, so
I'm going through your podcast library, and good Lord, yes, yes, you are.
I do listen to quite a few podcasts. So yeah. Anyway, but thank y'all so much for tuning in, and we are so excited because last week and the week before we had a bunch of calls and questions related to Medicare benefits. When do I need to sign up? When is it too late? When is there a penalty imposed? All kinds of questions. And so, fortunately, we have a really good friend, former co-host of the show, Will Corporon, on the line. Hey, Will, how are you?
I'm doing well. How are you doing?
Pretty good. Pretty good. We're just hanging in there.
I'm watching you.
Oh, are
I'm
you?
watching you on the camera. Yes, and it's interesting. There's a pretty good delay. So,
Yeah.
It's about I'm waiting. About a 5-second delay, maybe.
Okay.
Doing well.
That is funny. So yeah, so just for the people who are tuned in that don't know you or what it is you do, tell them, and where are you, and let's just dive into it.
I've been in insurance now. That's going into 20 years. My 20th year will start in 2022. I can't believe it's been that long, but anyway, I have an agency in here in Northwest Arkansas. I've got an office in Benton, in Bella Vista. Mm-hmm. But of course, with COVID, I also office here at my house in Bentonville and travel all over. I've seen quite a few. I've got quite a few shut-in clients, that can't get out, and so I do my best to see them in person when I can. One of the things about COVID, though, is that all these insurance companies and many other companies, had to mobilize to the internet in order to get business done.
Right.
So now there's so much I can do. I mean, just last night, I visited with new clients and got them enrolled. One was from Imboden, over in Lawrence County. Yeah, she goes to doctor in Walnut Ridge.
That's
the old stomping grounds.
Imboden.
I bet it's Dr. Spades.
No,
Dr.
Diamond.
Dr. Diamond. Okay.
Dr. Diamond, and then the other was in Camden. So that was just last night, And
cool.
Wow, you're all over the state.
The internet as well, and it's, I've gotten clients in the last year and a half or so, Florida, Texas. I mean, it really is. It just depends. But anyway, so.
Wait, hold on.
Back to here.
Hey, Will, hang on 1 second.
Yeah. We got a call.
We got a phone call.
Okay.
All right, let's take this call.
Hey, caller, thanks for calling. What can we do for you?
I had a piece of property that ran from Bentonville, Moberly Lane, all the way over to Whispering Timbers. The freeway come in and took about 2 or 3 acres of it, but they left me almost a half acre on the east side in the Rogers City limits, and it is zoned for a cell tower. And I got a letter in the mail from Miami, Florida, wanting to buy, I don't know if it's that piece of property or not, but they wanted to buy some land, and they got that. How can they get information like that all over the United States out of our courthouse?
It is public knowledge. Anyone can go down and pull any land record. It's just public knowledge. So, there is no privacy on what you own real estate wise.
Okay, well, I thought, because I told somebody else about it, they said that sounded like a scam. So,
well, I'm not saying it's not a scam, but your question was how did they learn about it? And
right.
Now, I will tell you the scam going on out there is that these people saying that they will protect your deed from getting transferred or sold. That's pretty much a scam. That rarely, it probably does happen, but it's rare. But yeah, it is public knowledge. I can call down there and I can get. We do it all the time actually. Clients come in and so we go online or we call the courthouse and they will send us a deed on pretty much anything.
Boy, there's nothing private anymore.
Well, your real estate is not private. That is correct.
Oh, okay. That's about the only thing that's public, huh?
Well, no. No, there's a lot of things public, but that always has been public knowledge just so people can know that they, who owns property and who's selling it or buying it or whatever. So.
Well, I was wondering if some of your listeners has gotten letters like that, if they'd call in and see what they'd think.
Okay.
I'm out in the dark on something like that.
Yep, we are here for you. All righty? Thank you, sir.
Thank you very, very much.
You're welcome.
Okay,
all right,
back to Will Corporon on the line.
Yeah, go ahead.
Anyway, I was just going to say, mostly what I do around here is teach Medicare. I talk to people about how Medicare works and then help them, if they need help deciding what to do. I can enroll them, visit with them about it, and offer advice.
Sure.
And that sort of thing.
Okay.
You have to teach a Medicare program? I mean, it's the government. Shouldn't it just totally make sense and be simple to do?
Man, I can hear the drippy sarcasm right from your voice.
We have another call coming in. Tommy, quit checking your mail and pay attention, please.
Okay, here you go, man.
She's sassy.
Yeah, she is. I'll reach across there.
Hey, caller, thanks for calling. What can we do for you? Hello? You're on the Answers on Aging show.
Nope.
Okay.
They're not there. Okay. All right. Sorry about that, Will.
Okay, Will, I do want to tell you, last week, one of the callers about Medicare had this question, basically. He's going to be, I think, 65 in a month or two, and he hasn't signed up for anything, so he needed to know, when and how and what happens if he doesn't.
And when can he sign up?
Yeah.
So we'll assume that he's not going to have group health insurance when he goes in, he's not going to work, so he's just an individual.
I believe he is working.
He was working. I think that was his question was he is still working, he still has group insurance, and so does he need to sign up for Medicare?
Yeah.
Okay.
And let's say he turned 65 in February.
We'll take that then. Assuming someone has group health insurance and they want to keep their group health insurance, maybe they want to work, till age 68 or 69, 70, he should go ahead and enroll in a Medicare Part A. There is no cost to enroll in Medicare Part A.
Okay.
He can delay Medicare Part B until he is about ready to retire. In a month or so, a couple of months out from his retirement, he can fill out a couple of forms, have the employer sign off on one, get those to Social Security. They will enroll him in Part B, and he will not have a penalty.
Okay.
So that's how it works with group health insurance.
Okay.
If somebody wants to continue it.
Gotcha. So then.
But let me put a caveat on that, because if somebody is working, if somebody is working for a company that is very small,
right?
I think it's 50. Fewer than 50, it may be 25, but anyway, small. Before they decide whether or not to enroll in A and B or just A, they really should call or talk to their HR person or call their group insurance. Now, if they're working for a company, with a bunch of employees like a Tyson or a Walmart or J.B. Hunt, a hospital, then that's different. They can automatically delay Part B. But if it's a smaller employer, they need to verify that so they don't make a mistake. Now, if someone is drawing Social Security as they turn 65, you can start Social Security very young if you're on disability, or if you want, you can, and you're not on disability, you can start drawing at age 62. That does not affect your Medicare one way or the other. You can't have Medicare until age 65. But if you're drawing Social Security before you turn 65, you will automatically be enrolled in Medicare A and B.
Okay.
And you'll just get it in the mail. You'll get the card in the mail, and that'll be automatic. And again, that's if you're already drawing Social Security.
Right. Okay.
If you're not drawing Social Security, given COVID, you're really going to have to do it on your own on the Medicare website, the Social Security website, or just find a way to get Social Security on the phone or a face-to-face. But it's very difficult, as we all probably know by now, to get hold of anybody right now in any sort of government on the phone or in person.
Okay. So let's say they hear you, they have intentions of doing exactly what you just said, but they don't, and they wait for however long it takes to have a penalty imposed. Can you explain to the listeners what that penalty looks like and how much it's going to be, why, and how long they have to pay it?
Yes, and it is substantial. The window for signing up for your Medicare is 3 months before your birth month, plus your birth month, and then 3 months after. And if you don't get Part B when you're first eligible, your premium is going to go up 10% for each 12-month period that you could have had Part B but didn't sign up. If you miss it and you don't sign up, and like I said, there's a 7-month window there, 3 months before your birth month, 3 months after. If you miss that initially, then you're out of luck until the Part B late enrollment period comes back around, and that is always from January to March of a calendar year. But then it won't. Your Part B actually won't go into effect until July. So depending on the time frames and all that, you could really miss being on Medicare B for over a year, and then have that 10% penalty. So that was another thing I wanted to talk about. The Medicare cost, because that Medicare cost for 2020 just went up 14%.
Oh my gosh! So what is it?
It's going from $148.50 for Medicare Part B right now to $170.10.
Good grief!
Starting January.
Okay, and just to clarify, please explain what Medicare Part B covers. Like, what is that coverage going to help pay for?
So when you sign up for Medicare, there are two parts. There's A and B. A is no cost because you've paid into that most people have paid into that through their working years.
Right.
B is it's called medical, but it's really outpatient. A is inpatient, B is outpatient. B is actually optional, but it really isn't, because if you don't have B, you don't have outpatient coverage and you can't get any other plans. So B covers things like your doctor visits, MRIs, CAT scans, all sorts of outpatient things. It covers emergency room, medical equipment, ambulance. So all that is covered under Medicare B. And the cost for Medicare B, again, starting in January, for people that are on Medicare already or new people signing up, the cost for B is going up to $170.10. It's the largest increase I can remember in forever that I can recall.
It must be that darn shipping shortage we got going on.
Yeah, it's the container shortage is causing it. So basically, I read quite a bit of different things, and it's obviously like everything else in this day and age. It's become very political. They blame all sorts of things, from a new Alzheimer's drug to rising costs from COVID. And I'm sure there may be bits and pieces of all that, but there was a very small increase last year. It was like 2%. It just went up a couple of dollars. So, I just feel like it's, and really at this point it doesn't matter why the reason. That's going to really suck for seniors. Now, the other side of it is everybody on Social Security is going to get over a 5% increase, on average about $92. So even with the increase of about $20, they will see, or they should see, everybody should see a little bit of a bump up in their
net gain
in their Social Security.
Yeah. So Tommy's sitting here, Tommy's 65 and above, and he just handed me 4 mailings that he got just recently.
Yeah, just read. I get them all the time.
Yeah.
And so, he's being inundated. Here's one from Blue Cross Blue Shield, the National Federation of Retired Persons. I don't know where that one's from. It's a yellow card, and then he's got his Medicare book. And so there's just so much stuff out there. And here's one, it's the new 2022 no-cost Medicare benefit. Healthcare reform means major changes to Medicare. Some Medicare health plans are being discontinued while others are raising
Do me a favor.
Yeah.
Do me a favor on that one right in front of you. I'm watching you. On that one right in front of you, turn it over and read the fine print.
Okay.
Let's see. Yeah, well, it's
I have.
Yeah, not affiliated with or endorsed by Medicare or any government agency. By providing the information below, I grant permission for a licensed Arkansas agent to contact me.
Right.
Yep.
So basically, that's what people need to be aware of. All these things, they look official, they sound official. All of them are really worthwhile when you put them in the fireplace and throw a match on them. They can provide a few seconds of heat.
Call a local agent.
And
we always say that, yes.
Yeah, there's another one there, Sarah.
This one that I've got, the little yellow postcard on the back.
Yeah.
And I mean, it does. It looks official. It's got, all kinds of demographic information and government-looking stuff on, but at the very bottom in teeny tiny print, verify the address for this information request. This information is not affiliated with or endorsed by the U.S. government or the federal Medicare program. You may be contacted by a Medicare, Medicaid advisor's licensed insurance representative. You will. That is saying you will.
Numerous times.
Very likely. Yeah.
Well, and that's exactly what those are.
Yeah.
This is lead generation. There are companies that spend, millions of dollars advertising, whether it's direct mail, whether it's the Joe Namath commercials or the J.J. Jimmy Walker commercials, right? All those are designed to have people call in or write in.
Yeah.
And once you call or write, you have given them permission to contact you.
Right.
And they will contact you, if not once, about 150 times.
That's right.
And it's really obscene, to be honest with you. I go into these folks' homes, and they've got a 1.5 foot stack on the dining room table of all this junk mail, and
even that Medicare and You book that you have there in front of you,
Yeah.
Everybody's familiar with that. The government sends it out. It reads like Korean stereo instructions, truly. and that's it. And that's if you don't speak Korean.
Right. Yeah.
So I mean, it really is. Yeah, that's it. It really is. And here's the thing. It all is confusing, and right? Even some of the smartest people I know, it just drives them crazy. There is never a cost to sit down with somebody who knows what they're doing, a licensed agent, somebody at a place like RSVP or area agency, and at least get some guidance. There is no cost. It's so frustrating that people won't do that. They just for whatever reason, choose not to.
Well, I think that they don't realize that there's not a cost, or that it's not going to be like some type of high-pressure sales meeting at the end where there's a catch. Like, okay, I've given you all this free advice, now you got to buy something, and that's not the case.
Well, if you go to someone who just sells one policy, one insurance company, and I love Blue Cross Blue Shield. I think they are a great company, but if you walk into their office, don't expect to be pitched Humana or United Healthcare, whatever. You're going to get a Blue Cross Blue Shield policy from them. So
Will, isn't this the same thing? All this mail I've given here to Todd and Sara to look at, isn't that the same thing when you see Joe Namath come on or JJ and it's free?
Yes.
Hey, clearly Tommy wasn't listening earlier.
Well,
that's exactly what he said.
I was opening my mail.
It is the same, and basically those commercials, and Sara, we talked about this a month or so ago. All those commercials on TV are not for any particular company. Yeah. Those commercials are for generating sales. They want people to call in. They talk about, like Joe Namath, all the things he mentions, all those benefits are what Medicare has allowed to be available as benefits around the country for Medicare Advantage plans. But those benefits are not available everywhere, and they're not necessarily, even if they are available where you are, it may not be a plan that would be best for you. That's the thing. You really have to ask more questions. And as I've said for a decade or more, you have to get the drugs right. Every choice you make with Medicare has to be based on the medicines you take,
right,
your health at the time, the doctors you're seeing, and that's different for everyone. So there's not a one-size-fits-all.
Hey, Will, how many companies do you represent? I'm just curious.
How many companies?
Yeah.
Wow.
That many?
Yeah.
Okay. I mean, is it 6, 10?
No, it's Medicare. If you're talking about just Medicare Advantage companies, probably I don't know, 8 to 12, 8, 10. Wow. There aren't that many really.
Okay.
If you're talking about companies that sell supplements, it's probably closer to 20 or 25.
Wow.
So, I mean, but you obviously have a program somewhere that you put in their drugs, their things, and it will tell you which company has the best rate?
Yes, and that program is actually free. It's online for anybody to use. It's Medicare.gov.
Oh, wow.
Medicare.gov. And like anything, though, Todd, the problem is, the information's out there, but you have to know how to use it, how to get to it, and then how to interpret it.
And I think what surprises people is, that like the plans A through J or K or M or whatever, what those plans provide is absolutely dictated by Medicare, but each company can charge different fees for it. So you are truly paying more money or less money for the very same benefit that some other company offers plan J or whatever, correct?
Right. So
Okay.
Plan G, which is kind of because J and F aren't around anymore for new folks, but let's just say Plan G like George, okay, G.
Okay.
Plan G is offered by every company that sells Medicare supplements around the country.
Okay.
And every Plan G is exactly the same. It's a commodity. I tell people it's like a can of corn. You can go to the grocery store and buy 6 different cans of corn and peel the labels off, and you may pay different. You're going to pay different amounts for all those cans, but once you open the can and dump it out, what is it? It's corn.
Yep.
Corn.
Right?
Okay. Yeah.
So it's a commodity, each one.
And then your Advantage plans are, quote, free, but they offer vastly different benefits, correct?
So Advantage plans, Medicare supplements so let me back up. Medicare supplements work with Medicare. So when you have a claim, the claim is filed simultaneously with Medicare and the supplement.
Right.
And then they both pay, and if there's any little bit left over, you pay.
Okay.
Advantage plans are private insurance companies. Most of the plans don't cost the client anything. That's true. The government, Medicare, pays those Advantage plans to take care of the patient, the client, whoever has it.
Right.
And they pay them handsomely. I mean, it's $1,000, $1,200, $1,500 a month, depending on where they are and what some of their ailments might be.
Hey, Will,
so they're really good plans.
Hey, Will, can you hold that thought for just 1 second, okay? Whoops. Wrong. Hey, caller, thanks for calling. What can we do for you?
Yes, I had another question. I called in last week about turning 65 next month.
There we go.
And I got online and signed up, and apparently I signed up for too much, and I got a card, and it said that they were going to eligible, I think, December the 1st for Medicare A and B, and I am still working. I still have insurance. So I have contacted them, and they sent me a form, and she told me to completely withdraw both A and B because I have an HSA, and I would not be able to contribute to that anymore unless I completely withdrew everything. But then you all say that I would pick up a penalty if I don't sign up now. So my question is what do I do?
Okay, so the HSA is an interesting wrinkle. And she's right. So if you didn't have the HSA, I would recommend that you turn that card over that you got in the mail, sign the back, disenrolling yourself from Medicare.
Back to them.
Right. So with an HSA, that's right. You cannot, the government will not give you the tax benefit of contributing to the HSA if you have other coverage. And they would count Medicare A, even though it costs nothing, as other coverage, but you will not have a penalty because when you are ready to retire, okay, or at any point you decide you don't want to be on that group insurance anymore, you can then go back and enroll in Medicare again, okay, do it again, re-enroll, and that starts it over with no penalty. Now, in order to do that, you have to have a signed form. It's very simple. It's a single page from Social Security, from your employer that says you have had, coverage that whole time, so you haven't been without coverage. So as long as you stay on your group, you're not going to have a penalty, okay?
So this form I sent back to her, she got really hateful with me and said something about, well, you're listening to too many people. You shouldn't have signed up anyhow. Well, they're telling you that you should 3 months before you turn 65. So, the average person would think they had to do that.
Right. And your case is very, is not normal. There aren't that many people that actually have group HSAs. So in the grand scheme of things, yeah, but it's easily remedied, and you did. You're fine. You're going to be just fine.
Okay.
Okay. So I will not pay a penalty.
You will not have a penalty so long as you maintain that group health insurance until, you get back on Medicare.
Okay. All right. Thank you, sir.
Okay.
You're welcome.
Man, Will, he called last week, and I was like, oh, you better sign up because there's a penalty. I did not know the HSA wrinkle, like you said. So that's very interesting.
I don't mention the HSA wrinkle a lot because it confuses the matter.
Sure.
Again, this is a reason people need to come in and sit down and talk to somebody, because then you can ask specific questions.
Right.
Exactly.
What's your current plan? Is it an HSA? Is it a PPO, HMO? What are your medicines? Again, everybody's situation is like their fingerprint. It's very individual, and people need to treat it as such.
Okay.
That's right.
Continue with the Advantage plan, and then also Sarah and I would like for you to discuss the donut hole.
Yes.
Okay, so Advantage plan is a private company that is paid by Medicare to take care of the client. Now, by law, every Advantage plan must cover as well as Medicare A and B. Okay, that's the floor.
Right.
One of the advantages of an Advantage plan is, well, they all cover significantly better than that.
Yeah.
They have a lot of benefits, and this is the advertising that you see. The new latest greatest is, hey, we can put your Medicare Part B back in your bank account, and dental and vision and all those things that if you have a supplement in Medicare will not be covered.
Right.
And there are a lot of really good benefits within those. So, but you just have to understand that even though it may not cost you anything per month, if you have a really bad health year, you may spend, $2,000, $3,000, $4,000, $5,000, $6,000. But if you don't, if you just have kind of a normal year, you may spend $100. So it really depends, but you have to understand that that's how it works.
So
now there are different kinds of Advantage plans in different companies, but that's I don't want to get too weedy.
Okay, yeah. Let me clarify real quick. You said you would pay money out of pocket. Is that with an Advantage plan or with traditional Medicare?
Well, it's with both, but with original Medicare, depending on the plan you have, your out of pocket is pretty limited to, generally speaking, a couple $100 a year, maybe the Part B deductible is a little over $200 a year.
Okay.
Some of the plans like Plan N, you might spend, $300 or $400, but it's not too much. The Advantage plans, it could be, it'll be whatever the maximum out of pocket for the plan is. Some are as low as, $3,400, $3,500 per year out of your pocket.
Okay.
Some are all the way up to the maximum allowed, which is $7,500.
Wow. Okay. Interesting.
But again, it is rare. I'll give you an example. In 2019, there was an Aetna plan that about 40,000 people, 35,000 people kind of in our region had. Of that 35,000 people, only about 7 actually met that out of pocket.
Wow.
Goodness.
Okay.
Of about I think it was about 5,700. So it doesn't happen very often because of the limits within the policy. So even like a hospitalization that would keep you in the hospital for weeks at a time, somebody's out of pocket might only be $1,500, $1,800 total.
Okay. Interesting. Okay.
How can someone get a hold of you, Will, if they have yet to meet with a Medicare representative that could give them all the facts and help figure out if they need to make any changes to their existing plans during this period?
Well, first of all, the period we're talking about, the annual election period, runs up until midnight, December 7th, almost said 1941, December 7th, 2021, Pearl Harbor Day. That's how I remember it. So December 7th.
Yep.
Now, if they want to give us a call and visit, again, no cost. Our number is 479-855-MEDI, like Medicare, MEDI, 855-MEDI, MEDI. Those numbers are 6334. That is the easiest way. And if they miss that, they can call Tommy later. I knew it. I knew it would be. He'll never forget it. But anyway, it's
we have a call.
Oh, there's a call.
We got another call.
All right.
Okay. Are we going to
Well,
be
hang on
brave
here.
and just try it? Or?
Well,
Let's do it.
someone else picked it up. Stand by. If it's for us, I'll break in on you.
Okay.
You know, it's funny, if I'm not there, you get all the Medicare calls.
I know,
exactly.
I know.
Yeah, really, man.
All the
That's
time.
how it works.
Well,
Yeah.
we always give them your number.
Yeah,
We're like, you need to call Will.
Yeah.
Well, you wanted to know about the donut hole.
Yes.
Oh, yeah. Yes.
So, for people where that affects, the donut hole is a measure of how much their drugs cost in the calendar year. Okay, every drug plan starts January 1. Okay.
Okay.
And the first part to determine when they go in the donut hole, if they do, is what is the total cost of the medicines they are taking. So if they're taking a medicine that the total cost is $100, even if they only pay $5, that $100 counts. So if there's a drug they take and they pay $5 and it's a $100 drug, that means the insurance company pays $95. Okay.
Yep.
So your part plus the insurance company, $100. That $100 counts towards the donut hole. Now, the donut hole starts when someone's total cost of their drug since January reaches $4,300. And, you know, that sounds like a lot of money, but, you know, it's really not. So once your plan is $4,430, so $4,430. Once you and your plan have spent a combined $4,430, you go into the coverage gap or the donut hole, and you stay there until you have spent out of your own pocket up around $7,000. I'm looking for the exact number. It's a lot.
And this
And
is
that's
if
why-
you have a Part D plan. If you don't have a Part D plan, you're paying for your drugs, right?
Right. Well, and
100%,
again,
yeah.
if you don't have a Part D plan, you're going to wind up, if you do want it at some point, getting a penalty. They will penalize you. It works out to about $3, $4 for every year. It doesn't sound like a lot, but that's added on to every monthly premium you pay.
Mm-hmm.
So the max out of pocket for 2022, the MOOP they call it, max out of pocket, MOOP, is $7,050.
Okay.
So and that's out of their pocket. That's out of the client's pocket. That's
Sure.
not anything that the insurance company spends. And you know, some drugs, you know, cost $600, $700, $800 or more per month. Now, once you're in the donut hole, you don't have to pay out the whole part of it. You pay about 23% of the cost. So a drug that costs $1,000, you're going to have to pay, you know, basically $200 of in the donut hole.
Yep, that is true. So, but once you get through the donut hole, they pay like 95%, don't they?
Yeah, once you're through it, of course once you're through it, you have paid $7,000 out of your pocket.
Right.
But once you get to the other side, your drug costs are going to be about $3, $7, $2, even if they're pretty expensive.
Right.
Most of them are going to be a lot.
And
cheaper.
there are numerous different types of Part D plans. Some of those more expensive Part D plans pay through the donut hole, correct?
I don't know of any plan that covers everything through the donut hole. Some of them will cover tier 1 and 2 drugs.
Okay.
In the donut hole.
Okay.
I don't know of any that will cover through. Now, when these plans started back in 2006, 2007, there were plans that did that, but they were $200+ a month, and they went away pretty quickly because they realized they were losing money pretty rapidly.
Sure.
Sure.
Okay. Now,
so
does the other Advantage plan cover your drugs?
Most Advantage plans include the Part D.
Okay.
And it's built into the zero cost if you have a zero cost plan. Now, if somebody gets a Plan G, for example, kind of the average rate right now for a Plan G is going to be somewhere between about $135 and $150 a month.
Okay.
Yep.
And then on top of that, you're going to have to put a drug plan. And the drug plans run anywhere from about $7 a month to, $100 a month.
Mm-hmm.
Okay.
So
interesting.
Okay.
It depends. And again, there are about 32 drug plans, and some of those are with the same company. But even if a plan is with the same company, it does not mean that the formulary is the same. The list of drugs, the coverage.
That's what I was just going to say. The Medicare and U book that I'm looking through has the fine print at the bottom that says if you qualify for extra help, your monthly premium and amount you pay for each prescription may be less than amounts listed in these columns. Contact the plan for specific formulary and cost information. So the formulary is the list of covered drugs for your specific plan.
That is correct, and they're all different. Now you mentioned extra help or low income subsidy. That's a program through Social Security.
Mm-hmm.
I actually help people apply for that if they come in.
Okay.
It's a pretty easy process, and usually we have an answer within about 2 to 3 weeks, and that eliminates the donut hole for people that qualify for it. It lowers the drug cost, but it is income and asset based.
Okay.
So for a couple, assets cannot be more than $29,000. That does not include personal assets, home or car.
Okay.
But if you have an IRA that has $70,000 in it, you're not going to qualify.
Right.
So there's some income, but if somebody's somewhere around $1,500-$1,600 a month or lower, and that's pretty well what they have, and they're fixed income, and they don't have much in the way of assets. For an individual, it's about $14,000 in assets.
Okay.
They want to qualify for that, and it's really worthwhile for them to apply, and it's very easy.
Awesome. Well, Will, gosh, we could just pick your brain forever, but we got about 5 minutes left in the show. I do have some really good jokes for today, so I have to ask you to wrap it up and give your numbers.
She is sassy today, man.
Yeah.
Will, are you there?
I'm here.
Oh, okay.
Yeah.
All right. So, yes, give us your number, and so people can...
I missed that part. Yeah.
Okay.
So, certainly give us a call if we can help. Again, no cost for any advice. 479-855-6334. Easy way to remember that, 855-MEDI, like Medicare, MEDI, 855-MEDI.
Thanks, Will. It's always good to have you on. You are the expert, and we appreciate it.
All right. Thanks for having me on. Y'all have a good day.
Thanks, you too.
See you, Tommy.
You bet, Will. See you around.
All right, Sarah, do your thing. What?
Nothing.
Do your thing. Your joke thing.
Oh, yes. I have some good ones.
What? Look at me like I lost my mind.
I didn't know what you meant.
Do your thing.
I'm sorry.
Do your joke thing.
I was just thinking about all the new things I learned about Medicare.
Oh, okay.
Thanks to Will.
Hey.
I mean, all those. I was trying to honestly think at the last second if there were any other callers last week that had questions about Medicare that we didn't ask him. Is what.
Okay.
So, but I don't think so.
I think you guys got it all.
We got it. I think we got more and more.
Yeah. And more.
And more. Okay, here we go.
I'm ready to laugh.
Okay. I went to the zoo and saw a baguette in a cage. The zookeeper said it was bred in captivity.
Yeah, all right, that's enough.
Funny. I thought that was hilarious.
Bred in captivity.
That was pretty good.
Okay. Why does Humpty Dumpty love autumn?
Why does Humpty Dumpty love
something about fall?
Fall. I don't know.
Okay.
Because he had a great fall.
He had a great fall.
All right, quiet over there.
Great fall.
That's pretty good.
Okay.
The studio audience is loving these.
I know.
Well, they're supposed to hold it down.
What? Okay. Why did Cinderella get kicked off the soccer team?
Oh, no.
Something about her glass slipper.
No.
She slipped on glass.
Because she ran away from the ball.
Now, that was pretty good.
I thought that was cute.
Yeah, I think you can do better, though.
Okay, here we go. Do you not? Jeez.
We got 2 minutes
I'm about
now.
to start doing old people.
Getting rough.
What do prisoners use to call each other?
A cell card.
A cell phone.
Oh.
Very good.
Okay. Get that guy out of here. All right.
Sarah, I like that one.
Yeah.
Oh my God.
Yeah.
Oh my goodness.
Fine.
A
I
cell
can't
phone.
breathe.
You cracked that little musketeer up, let me
He
tell you.
sounds cute.
Yeah, he was.
Okay, give us a call at Todd Watley, PA.
Yeah, 479-601-4119, 479-601-4119. Call us, tell us you want to meet with us, and chances are you will meet with Sarah first. Phone, in person, or Zoom.
Yeah.
And Zoom depends on if she puts her makeup on or not.
True. Very true. And next, I think maybe next week or in the coming soon weeks, we're going to have a really exciting special announcement from Ozark Regional Transit.
Okay.
Your local public transportation
Yeah.
system serving.
I'm already getting excited about the hospitones.
I know. I haven't firmed that up yet.
Yeah.
I have reached out to Pat Hall. If anybody out there listening knows Pat Hall, tell him to call me back.
Yeah, we want him in here with that hospitone sound of a holiday.
I know. That's one of our favorite.
It is.
We didn't do it last year because of COVID, right?
Yeah.
Yeah. We replayed the year before. So, tune in next week. We will be here live again from 9 to 10. If you want to get a hold of us and didn't get to call in today, we'll be here next week. And don't forget our podcast.
Yeah. Thank y'all very much.
All right, Todd.
We'll see y'all next week.
Yeah,
Bye.
we'll see you around. Go Hogs, beat Alabama. Anyway, KURM, Roger.